In our next case, Kenneth has a tumor, a glioblastoma multiforme grade 3. He initially presented with a non-specific headache located in the front of the scalp and was treated with sinus-related medication and antibiotics. Kenneth, I understand that you developed headaches in August of 2001. What did you do when you developed these headaches?
Well, I went to my general practitioner and asked him what we could prescribe to get rid of them.
And what happened then?
He prescribed sinus-related medications and an antibiotic, thinking it was a sinus headache. And I got them filled and started taking them.
Where was the pain located?
Over the right front of my head, for the most part, in the front.
In a scale of 1 to 5, with 5 being the worst pain, how would you describe the pain?
Moderate, 2 to 3.
2 to 3. So this is a mild type of headache.
Well, it's bad enough to concern me.
Bad enough to require medications?
Yes, I thought so.
Okay. Did you have any other symptoms besides the headache when you first saw the doctor?
Not when I first saw the doctor.
Did you develop anything like nausea or vomiting?
Later on, a couple of weeks afterwards, I did, along with hand contractions in my left hand.
When did you develop that?
Approximately 1 week after I got all these prescriptions filled.
Then you went and saw your family doctor again?
I did.
And what did he say?
He sent me to you.
Okay, all righty. So was he, at the time when you started these contractions, did these come on spontaneously? Could you control them?
I couldn't control them.
And how often were they occurring?
For a while it was about once a day.
Okay, once a day. Did you have any contractions of your leg?
No.
Okay. Did you have any dizziness with these headaches?
About a week after I initially saw my general practitioner, I started having some dizziness, and I had some nausea, and I actually had some urinary incontinence as well.
How many episodes of urinary incontinence did you have?
2 or 3.
Okay. Were any of them associated with the movement of the hand?
Not that I know of.
Okay.
No.
Were you totally awake when you had the urinary incontinence?
Yes.
Where were you when you had that? At home or at work?
Church, I believe a store, and once at home.
Did you go to the doctor with the urinary incontinence?
No.
And then I examined you, and your exam was normal, and then I did an MRI of the brain.
Yes.
What did that MRI of the brain show?
MRI showed a mass over the right frontal lobe.
Okay, and then we admitted you to the hospital. That's correct?
That's correct.
And then what happened after that?
We transferred me down to MD Anderson.
What did they do at MD Anderson Hospital?
They did a total resection of the tumor as much as they could.
When was the resection done?
October 4, 2001.
Okay. And what happened after the resection? What did the biopsy or what did the resection show?
The diagnosis was a glioblastoma multiforme, grade 3.
All right. Since you had the surgery, how have you done?
Real well, according to all the doctors down there and the radiotherapy technicians.
Okay,
and
tell us a little bit about what's happening to you and what treatments they're giving you.
I'm involved in a phase 2 clinical trial where I'm taking interferon injections once a week and Accutane oral prescription 5 days a week, and I'm having radiotherapy done Monday through Friday every day, and that's it.
Have you had any side effects from any of these treatments?
I've got some scalp sensitivity in here where they do the radiation, and I've had some some headaches from the radiation, and